Good afternoon. My name is Mark Johnson, spokesperson for the Beadle County COVID-19 Unified Task Force. Before moving into our roundtable discussion, I'd like to start with a brief update from the task force. The current update from the South Dakota Department of Health shows 21 positive COVID-19 cases in Beadle County and 1,411 cases statewide. Beadle County now has 19 individuals who have recovered from COVID-19. As we move forward, we continue to hear of the steady numbers here in Beadle County. The Beadle County COVID-19 Task Force wants to thank the public for following the direction their elected leaders have enacted. We continue to encourage staying at home, reducing non-essential travel, minimizing trips, and maintaining our social distance while outside the home, and following the resolutions, ordinances, and executive orders. The spread of COVID-19 is still a threat, as we have seen during the last week or so with other communities in South Dakota. Weekly, we do get asked if Beadle County is still testing. The Beadle County COVID-19 Test Center, along with other healthcare providers, are still averaging about 3 tests per day. Since testing started, there has been over 150 tests that have been completed in Beadle County. The Beadle County COVID-19 Task Force would like to focus this week's community updates on the positive things that are happening around Beadle County. For example, earlier this week we learned about funding for rental assistance. We'll be talking with Mayor Paul Elward shortly about that. We have a great community, and the stories of us pulling together as a community to support each other has never been stronger. Whether it be individuals pulling together to make ear savers, sewing masks, making donations, or checking up on the neighbors. The stories continue to add up, and we could spend a month's time telling you about all the great things that have been happening in Beadle County. When we are faced with adversity, when we faced adversity and one of the toughest challenges of our lifetime, we still have a long ways to go. There's still that need to make masks, need for those ear savers, and continuing to help each other out. We encourage you to contact the Beadle County COVID-19 Task Force if you'd like to help, or you can also visit volunteers.sd.gov if you'd like to volunteer your time. We encourage the community to continue and support our local businesses, along with making those vital donations that keep our local organizations operational. We'll get through this together. I would now like to read a brief statement from Dr. Elise Brock, Chief of Staff at Huron Regional Medical Center. As some of you have heard on the news and in the media, HRMC will be getting an Abbott Rapid Point of Care COVID-19 testing machine. While this will allow HRMC to test high priority patients in a much faster manner with approximately 1 hour turnaround as compared to the 24 to 48 hour turnaround at the state health lab. It will not significantly increase HRMC's testing capacity. They still have a limited amount of swabs and a finite amount of reagent to run tests. According to the state guidelines, HRMC will still be testing high priority people in 3 categories: symptomatic patients that are in the hospital, symptomatic people who work in patient care fields, symptomatic residents of community living or group living centers. There will occasionally be exceptions made for other high-risk people with symptoms and known exposures. Once again, that was a statement about the Abbott Rapid Point of Care COVID-19 testing machine from HRMC Chief of Staff, Dr. Elise Brock. We are going to move into our roundtable discussions. If you do have questions, you can email them to covid19@huronsd.com, and we'll open it up for questions at the end. Keeping with our great community spirit, we are going to speak with Mayor Paul Elward about the rental assistance program. Mayor?
Well, thank you very much, Mark. Good afternoon, everyone. Glad to be with you. And I just want to talk a little bit this afternoon about a brand new service that's just been announced by our group this week, and tell you just a little bit about it and how you can use it. It's called the Beadle County COVID-19 Rental Fund. And because of the generosity of T. Denny Sanford, he made a donation of $75,000 to this. And also the Huron Community Foundation donated another $15,000 to the Huron Community Foundation, and that made it possible for us to form the Beadle County COVID-19 Rental Fund. It is for rental assistance to help out those people that, because of COVID-19, have lost their employment or had some change in their how they are paid or if they are paid. So we'd like to tell you a little bit more about that. The 211 Helpline Center will be doing the intake for all of the applications for rental assistance, and the Huron Housing Authority, another partner, will administer direct rent payments for eligible applicants. Eligibility guidelines are online, on the online application, and they can be found at www.helplinecenter.org/Beadle. Or you can call 211 and they can help you out there. But we do encourage the applicants to apply online because you do have to give some information to make sure that you're eligible for the assistance. I appreciate the Community Development Foundation, 211 Helpline, and the Huron Housing Authority for stepping up to help launch this program. Within a day of being contacted by Premier and about T. Denny's donation, we were able to get most of this set up and launch this program within 1 week. So again, anyone interested in making a tax-deductible donation to this relief fund could also contact Community Development Foundation Manager David McGurr at 354-6565 or by email at mcgurr@huronsd.com. And we will welcome all donations, big or small, no matter what. It will help someone with some rental assistance that really needs the help. Applications, again, you can find them by contacting 211 or going to the helpline.org/Beadle. This will be a one-time rental assistance, and we're going to limit that to 60% of your rent. So we will do those payments if you're eligible. Remember that this is only for individuals whose employment has been affected by COVID-19, and applicants must be filled out completely and accurately. Also, I want to remind the employers that must fill out the verification form that will be sent via email from 211 Helpline, because we cannot process the applications until the employer verifies that they are needed of assistance. So I want to just end by thanking the people that helped put this up. We couldn't have done it without Rhonda Clute, who generously headed this effort, Andrea Del Grazzo with the Huron Housing Development Corporation, and David McGurr with the Community Development Foundation and Greater Huron. So thanks to those, and thanks to a lot of other people, and thanks to the people who have donated and will donate. This will really help some people who are struggling right now. And if you have any questions, you can contact us here, or you can contact myself or David McGurr. Thank you.
Yep. Thank you, Mayor. Speaking of David McGurr, we are going to speak with him. David will be joining us by Zoom. He's going to talk to us about the business recovery loans that Greater Huron Development has been working with. David?
Thank you, Mark. Greater Huron Development did launch a small business recovery loans for Huron businesses. We had two philanthropists in the community step up to make this possible. They issued a challenge grant of $200,000 to launch the program and invite others who are in a position to contribute to that to help our businesses get through the other side of this, especially the small businesses. They're the fabric of our community, and they really need our help now. They've supported every fundraiser over the years, and now the shoe's on the other foot, and we need to step up to help them. I'm going to show you what the application looks like here. It's this is the eligibility guidelines. Depending on the size of your staff, you can be eligible for $2,000, $4,000, or $6,000 loans. These loans are 0% interest and no monthly payments. They're not due until 24 months after origination, so it gives a business a chance to recover from the impacts of the virus. So it's not intended to carry you through for a long period of time. It's more or less a bridge loan to get you through to when perhaps SBA or other funding become available to maintain business for the long run. You do not have to be a member of Greater Huron to apply for this. You just have to be a for-profit business operating full-time within the city limits of Huron that's had a disruption due to the COVID. And you have to either have your business open or have plans to reopen it. So there's not a lot of restrictions on this. You don't have to submit financials or collateral. We do require some verification that you actually are who you say you are, a copy of a driver's license and a sales tax license, but it's a pretty easy application. Eligible uses are payroll, inventory, utilities, internet, building rent, anything like that. The application is a simple one-page form. You fill in the business information, the applicant information, and describe the disruption and a few yes or no questions. And you certify that everything you're saying is truthful and submit the application. The quickest way to get it handled is via email. You send it to ghdc@huronsd.com. On greaterhuron.com, our website, we have a direct link to this loan application right at the top of the opening page. And that's our logo that goes along with that. The intent is we want to help Huron move forward and get through this crisis. We also have a link to the rental assistance program. So if you don't remember the link for the 211 helpline, just come to greaterhuron.com, second thing on the page. And we also have a resource page here. If we click on that, it takes us to a wealth of resources about Paycheck Protection Program, the Greater Governor's Office Economic Development loans, the economic injury loans, all kinds of resources that you could want. And then we have been doing a survey this week of Huron residents to see how they responded to the impact of the virus, and you can participate in that survey. We welcome you to. We've had about 1,200 people that have taken that survey since it was released a couple days ago. So if you click on the rental assistance, it takes you to this page. Pretty straightforward questions that you can answer there. It doesn't take too long to do. So anybody who has been impacted by COVID and has had their hours reduced or have been furloughed is encouraged to apply. If you've been laid off for other reasons, it doesn't apply. This grant from Denny Sanford was specifically for individuals that were impacted by COVID. This is a copy of the survey that we have about the COVID. Again, encourage you to go that. You can find links on the Chamber website or Greater Huron website, greaterhuron.com, or again, it's on the homepage there of greaterhuron.com. This week, the Chamber and the Development Corporation also partnered and released Huron to Go. And it's targeted primarily for restaurants, but any business can put something on here where you can stop by and get curbside delivery or carry out delivery on items. This is a live view. This is from Los Compadres. They just put this up a few minutes ago. Here's from Amy Gaethel at Hearst Corner. There's a shirt from Signature Plus, some popcorn at Huron Luxury Cinemas. There's just a wealth of businesses that are participating in this. We've only had it up started out late Monday afternoon, and currently we have, scroll back up here, 1,426 members of this group. So it's gotten a lot of traction right away, and people are putting specials on there, special menus that restaurants have, etc. If you have any questions about donating to the rental assistance program or to the business recovery loans, you can contact me on my cell phone at 354-6565 or email me at mcgurr@huronsd.com. Thank you.
Thank you, David. We're now going to switch gears and going to speak with Tammy Dramstead from Community Counseling Services. There's a lot of people that have essentially the entire household at home, and that can be add some increased stress. So we wanted to talk with Community Counseling about maybe offer some tips. Tammy, thank you for joining us.
Welcome.
I guess we'll get started right off the get-go. What are some general tips for adults to stay healthy while at home for an extended amount of time?
With adults, what we encourage them to do is build a routine, and that routine can be as close to mimicking what was their normal before. So if it was normal to get up at 7 o'clock and get ready for the day, we would encourage them to continue to do that. Anytime that you build that normal routine, and it helps to feel like you're in better control when things are somewhat unexpected right now. We would encourage adults to get adequate rest, eat healthy, exercise, though that may change. Instead of going to the Norby Center and working out, you may have to change how you do that, whether that's exercise videos or going for walks when there's not a lot of people out, kind of being mindful of social distance. So creating a new norm in that way. At this point in time, we encourage people to avoid the excess of any alcohol or drugs. If you're somebody that has struggled with addiction, moments like this can exacerbate it. So we encourage people to avoid using those substances. One of the ways that helps a person feel better is to be able to give back. And if you can find a way to give back in your community or give back in your home, and that can be to simple things like taking the time to call an elderly neighbor, checking on them, asking how they're doing, offering to pick up someone's prescriptions or helping with grocery shopping. If you are in the position and can donate to local food banks or other charities, that's another way to give back to individuals that are coping with the economic impact of COVID-19. And lastly, we encourage people to be kind to themselves and others. Kindness is a great contagion. It's the kind that we want to pass on, and it's the kind that we want to see out there. So we encourage kindness during this period of unease.
Okay. Are there any specific tips for children?
Children cope differently with stress and trauma than adults do. They will seek to share their story through their social narrative and play. That's the way they tell us about what their world is like and what's happening. So if you have children in the home, take the time to just be engaged in their play and let them kind of lead that play. Children right now are really grieving their sense of normalcy. They're not outside with their friends playing, they're not going to school. Prom has been canceled, so they're grieving pieces of that. So anytime again that you can build in some normalcy and keep that structure to your child's routine is going to be helpful. So structure that day, set aside specific times for schoolwork, like 9 to 11 we always do our schoolwork, and playtime, meals, sleep. Help your child know, it helps your child know what comes next. It helps them know what to expect, and that can soothe some of that unease. And then allow them to have some choices in their day. A lot of the situation they don't have a choice over. They're not able to go out for track, or they're not in signing up for T-ball or things like that right now. So some of that normalcy is gone. So allow them to have choice. And it may just be simple as, when you're done with your homework, why don't you pick out a game from our game closet and we'll play it together. So, give them little choices that help them find that sense of control again.
Tammy, there's constant media coverage about COVID-19. Should we be allowing children to be watching this? Should there be a time limit? Is there any guide that we should be using?
That's a really good question. Children will often hear a lot of misinformation on the media, from friends or in other conversations. So it's really important to limit the type of information that your child is hearing. If they are in that elementary to young middle schoolers, you probably want to limit that and just give them the information that they can hear from you in a level that they can understand for whatever their age group is. And if you're not sure what your child is hearing, take the time to ask them, what do you know about COVID-19? This will give you the chance to address any information that is incorrect that they're actually hearing. If they are high school, middle school age, you can again limit that information and help them look at sources that you trust. So it may be like from 5:30 to 6 you watch the evening news together. That way you can have a discussion if there's any information that is concerning to them. But being actively watching that news and watching those headlines 24/7 is going to create a lot of anxiety. So we encourage it to be limited to not more than 30, 60 minutes a day. And if it's creating extreme unease, then you might just want to limit that further and just fill in the questions that they ask.
Okay. I know there's a lot of people that are out there that I've heard from that maybe that are in that vulnerable population or are immune compromised. Is there specific tips for them, since they may not be even going outside the house and there's that fear of going outside the house?
That's a good question too. So people in those vulnerable populations tend to feel a lot of guilt about protecting themselves, because suddenly they are having to ask for more help from individuals that are in their family circle or in their neighborhood. So that sense of guilt of everybody's helping me, how can I help others, tends to come into play. They also may feel more socially isolated because if they're alone and they're suddenly not being able to have visitors due to the virus. Or they may have increased stress if they're in that lower economic household, or they have language barriers, or there's any stigma due to race or ethnicity. So we do have to look out for our vulnerable population. And one group that we often don't consider is the first responders. And those are individuals that are in our medical fields, or they're EMTs, paramedics, and people that witness what we call vicarious trauma, that through watching the impact it has on somebody else's life, they feel that stress at that moment. So as community members, we want to really encourage others to reach out to them. You know, set a time when you may call and check on them at 5 o'clock. You know, video chat with them, use social media, use some of those options like Zoom, Google Duo, whatever they may have available, and let them know that they are not alone at this point in time. You know, when people feel less alone, that helps with depression and anxiety and some of those symptoms that can increase at those times. Also encourage them to use things like if they're avid readers or they're having to fill some of that time being in the house, you know, use the library book drop off or some of those programs to keep that outreach going. And again, just, you know, reaching out to some of those individuals, just like by sending a card in the mail or a note in the door saying, you know, I'm available to help pick up groceries or pick up prescriptions. Please call me after 5 and let me know if I can be of any assistance. So putting some of those offers out, because a lot of people are very reluctant to ask for help. You know, as South Dakotans, we often want to show that we are you know, we're strong and we don't need any help, but you know, this is a time when it's okay to put those offers out.
Okay. What would be some warning signs if we have household members, or what could we watch for to indicate that someone may be depressed or may be at that point of needing assistance?
With depression and adults, we would look for a loss of interest in the activities that they normally like to do. So if they suddenly, you know, if they're a great baker and that was often something they like to do and they stopped doing that, or they, you know, stopped wanting to, you know, get that garden ready, things like that. It's that sudden loss of it that we tend to be concerned about. If they feel like just doing the little physical activities suddenly takes too much energy, like, you know, getting their laundry done or just, you know, going for a quick walk around the block is suddenly too much, then that would be another warning sign to us. Or if they describe feeling agitated or irritated, if they have difficulty maintaining sleep or falling asleep, or if they're an individual that struggles with dysomnias like night terrors or sleepwalking, and suddenly that's all increased, and you're seeing that more often, that can be another red flag. The other things to look for and to ask people is if they're having any difficulties with concentration or getting motivated or focus. Those are also can be signs of depression for people. And if individuals are talking about having recurrent thoughts of death and dying, or they are talking about a plan, that's another red flag, and that's probably the point when you want to help those individuals reach out and get some support, set up a time to meet with a counselor.
Okay. Are those some of the same warning signs for children as well?
For children, we would see more in their behaviors are going to speak louder than what they may be telling us. We may, with younger children, we would look for like excessive crying, more irritation. Younger children, we could see regression. That's where they would return to using behaviors that they'd outgrown. If, for say, they hadn't wet the bed in 3 years and that restarted again, or they had a fear of sleeping alone, those would be warning signs to us. Changes in eating habits, or just not seeming interested in doing their normal active play, things like that. With teens, we start to notice acting out, more like verbal, physical aggression, irritability, or it can go the other extreme where they're not wanting to come out their room, they're not wanting to engage, increased sadness. Again, and like adults, we would see issues probably with concentration, focus, and acting out. Um, the other thing that we see with both younger children and adults is unexplained headaches or a lot of body aches. You know, my stomach hurts, or my head hurts, and there's really no medical reason for it. And with teens, we would look also to if they hadn't started using drugs or alcohol to cope with some of those feelings of depression.
Okay. I know we touched on some of them. Are there any additional tips for individuals that maybe are doing everything from home with work, school, childcare, and everything's being done there?
The big thing is to find that balance. When you're at work, try to be at work, whether it's at home or not at home. And when you're in your family time, try to schedule and set aside that just to be family time. What you may have to do is be creative in when you do that work. Sometimes that's going to be easier when you got all the kids in bed, and then you can focus on a couple hours of work. So you have to allow yourself some flexibility. Sometimes we get very rigid in our thinking, and so right now it's forcing us to be creative and think outside that box and what that routine looks like.
Okay. How can an individual stay informed without creating more anxiety?
Part of that comes back to, again, limiting how much you're engaging in watching, and watching and or listening to the information presented on COVID. Anxiety is about worry about what's going to happen in the future, worry about things that haven't happened yet. And when you get stuck in your head and you run those marathon of thoughts over what's going to happen over and over and over again, that really can increase a person's anxiety. So we have to bring it back to looking at the pieces that we do have control over. We may not have control over how long this COVID pandemic lasts, but we do have control over certain choices that we make and certain things that we do during the day. And that is helpful in the sense of, empowering us again and getting us outside of our thoughts in our heads. So to focus on the things you can do, like we can control when we're outside, keeping that social distance or wearing cloth masks. Because obviously we don't want to take the medical grade masks away from the medical field. We can control when we go to the stores. Maybe we go to the stores at times when it's not as busy. So putting ourselves back in that seat of control and driving our own bus again versus letting our thoughts drive our head will help with that. And be proactive as far as if there are certain situations that just keep running through your head, like, will my spouse get sick because he has more is out there more in the community, or will is this going to be like this 2 months from now or such? Create some lists of all the different possibility of options that you have, and you're not looking for like only the best possible options. You're looking for all options, because sometimes we get stuck with wanting it to be the perfect option. And so at that time, just kind of brainstorm and look for different solutions. And again, it just gives you the sense that to every problem, there are many, many different solutions. And sometimes, again, we have to be creative at times like this.
Are there any different tips for an individual who may already have existing mental health conditions?
With individuals that already may struggle with anxiety or depression, anytime situations like this occur, or like in this situation where, this is new to a lot of us, and how we're dealing with it and coping, check in on them frequently, be more proactive in asking how they're doing. And then there's little things like asking them, do you have enough of your medication if they're on an antidepressant or something? And you may need to help them and prompt them to reorder, and help them with picking up those medications so they have those available. Allow them the opportunity to talk about what they're feeling and validate that, there's no wrong feeling. Our feelings come and go. We can have 12 different kinds of feelings in a day. So encourage them that whatever they're feeling is okay. And then talk to them about what's worked for them in the past. When you've had stressful situations in the past, what's worked? And is that something that you can apply again to using now? And remind them again that we're all in this together, that there is, we're all learning how to cope with a different normal right now in our world, and that we will all get through this together.
Okay. If a person is stressed to the point where they need assistance, what is the best way to reach out to community counseling services, or what options are available out there for a person?
Community counseling, we cover 7 counties, and those are Beetle, Hand, Drawled, Lake, Minor, Moody, and Kingsbury. And you can reach community counseling through we're still open. We're just doing things differently right now, so you can reach it through our normal phone number, or you can go on our website and reach out through that way. But we are still setting up those appointments. We are just using the video media like Zoom, Google Doodle, Facebook, Skype in order to have those counseling appointments. And we are still open Monday through Thursday, 8 to 5. And then Fridays, we are 8 to 4. And we have all the same programs that we had before, from substance use disorder programs to case management, therapy, psychiatric services, counseling. All of those are running just like we were before. Again, we're just doing them differently, and we're using media to do those appointments. And we also have, if there's concerns about how do I afford it, I'm not working as many hours as I have been before. We have programs to assist with that cost, so we can certainly help you figure out if one of those programs will work for you.
Okay. Thank you, Tammy. Do you have any last thoughts before we go today?
No, I just appreciate you all reaching out to us, and we just want community members to know that we're still operating, we're still here for them, and we want to help them while everybody is learning this new normal right now.
Okay. Thank you very much. We are going to go back to David McGurr. He has a couple last thoughts here for us.
I did want to mention that on the business recovery loans, we just opened that up on Wednesday afternoon, and we've already processed and delivered checks to 6 businesses in town for $24,000 total. So that a lot of interest in that program, and we are able to process those fairly quick. So we've gotten some money pushed out there to help bridge those businesses over. So I encourage all smaller businesses to take a look at this as a way to bridge themselves over the gap here between when you might be getting other funding to come in. That grant was put together, as I said, by 2 philanthropists. Terry and Nancy Schultz partnered with Paul Christian, and they each contributed equally to come up with a $200,000 challenge grant, and they've asked the community to match that, to have ample loans available. We did receive a matching grant from the Community Development Foundation, and we also received another matching grant from the Huron Community Foundation. So we've got a couple of nice donations to start on that match, but if a business is able to participate, or organization, even individuals, if you get your check from the government of $1,200 a person and you don't really need it, I would encourage you to give it to the Business Recovery Program or to the Rental Assistance Program, because there are people that are seeing their entire livelihood slip away right in front of their eyes. And so it's important that we reach out to both these people that are renting as well as our local business.
Okay. Thank you very much. I am not seeing any questions right now. I'd like to thank our participants for participating and taking time. Mayor, thank you for joining us. It's always a pleasure. Tammy Dramstead from Community Counseling Services and David McGurr from Greater Huron Development. We're here. You can send us an email. We'll answer your questions and go from there. But I believe that's going to end our live coverage for this Friday's community update. Everybody have a safe weekend.